Hi, Dr. Becky here. In this video, I want to talk about mask anxiety as we try to get back to a more semi-normal or the new normal lifestyle after the coronavirus shelter in place. The recommendation is to wear masks in public. For some of us, that is a real challenge. There are a lot of people who have claustrophobic tendencies, and this can affect a person's ability to wear a mask or not. So I wanted to put together a video that can be of help to you if you find that you have mask anxiety. So realize in the beginning that this is not intended to be therapy, and if your anxiety is really strong to the point of a panic, you might need to have a coach, a therapist who can help you work with these principles. So for the rest of you, just take them as you will and use them in a way that works for you. So the first thing to know about anxiety about an object is that the brain can pair things together, and sometimes we know why that happens and sometimes we don't. So let me give you an example of how it happened for me in a pretty understandable kind of way. I worked in inpatient rehab for a number of years, and over time I heard thousands of stories about car accidents. And so I had this huge catalog of images about how accidents happen and about some of the horrible outcome that can come from that. So one day I was on my way to work. I was in a really light truck, and at the top of a hill, I hit some black ice. And I immediately spun out of control. I ended up spinning across my lane into the other lane and then spinning back around and finally hit the curb and onto the grass. I was totally not hurt, but in the midst of that, my anxiety level was super high. I had all these images flooding in about what could happen. There were many things that could have happened in that situation, including somebody not even seeing me and hitting me from the other side of the road and such. I could have hit somebody else. But none of those things happened. However, in my brain, there must have been a pairing between that location and anxiety. Because for about 2 months, when I would pass that same location, I would have an instant spike in anxiety. And in the beginning, it was really strong, almost as strong as it was to begin with. The thing is, I knew what it was. I knew what had happened. The location itself was not dangerous, but my brain had associated those two. And so the job was to slowly disassociate that. So that location was not paired with that anxiety. So knowing how to do this, as I was able to work with it, and over time, it did go away. Now, for whatever reason, people can have anxiety about wearing the mask. It has become paired. The mask has become paired with anxiety. This can show up to start with in what we call anticipatory anxiety. And that is, without even having the mask on, or without even holding the mask, you might have anxiety in just thinking about wearing it. So that's anticipating the situation and anticipating the way you might feel if you put it on. So that's anticipatory anxiety. So we work with that in a few different ways. One, we learn breathing exercises, and particularly you want some strategies that help you have a deep breath in and a slow breath out. Now you have to practice these before you actually try to apply them to this mask situation. So watch the video that I did about breathing exercises, or read or watch YouTube to learn some breathing exercises that work for you. Now, here's the thing about deep breathing exercises, that you can't make anxiety go away, and there's no breathing exercise that will make anxiety completely go away. So when you're learning breathing exercises, one of the goals is to learn to practice an allowing attitude, a letting go of those breathing exercises making anything happen. When we're anxious, our adrenaline goes up, our body becomes tight and tense, we breathe faster and more shallow. If we can take gentle control of our breath, to deepen it, and to slow it down as we breathe out. Then we can begin to put the body in the position for the adrenaline to go down. We can't force it to happen, but we can put ourselves in a position for it to happen. So learn some deep breathing, slow breath out exercises, practice until it feels comfortable, and then keep on practicing. Then when you have this anticipatory anxiety, you can begin to use that deep breath in, slow breath out. And you do it through as many cycles as you need to begin to see a little reduction in that adrenaline. The other thing you can do is you can begin to work with your thoughts. Anticipatory anxiety is a lot about the images and the thoughts that we have about the situation, about wearing the mask in this particular illustration. And so when you notice thoughts that go through your mind like, this is stupid, I can't believe I can't do this, I'm stupid, there's something wrong with me that I can't do it. First of all, those thoughts are all false. They're just thoughts, but they're not accurate. And then secondly, they're alarming. They're thoughts that actually make your anxiety worse. If you can counter that with reassuring thoughts, so there are things that you can tell yourself that are true, but also reassuring. So when those thoughts about the mask come up, for example, I'll never be able to learn to wear it. Some of the thoughts that you might have are, I can learn, it can be better. I can learn some things that will make it better. I can practice these strategies that we're talking about, and it can be better. I've overcome other things in my life. I can work with this too. I can learn to see this in a different way. I can, like the kaleidoscope, you can see it in a different way. You can remind yourself, which is a reassuring thought, about why you want to learn to wear the mask. It's not just for the purpose of putting it on. The purpose is to let you go out and have more of a life. It's a means to an end. It's a protector. It's a friend. If you can change that perspective from it being an enemy, the mask is a friend to let you have more of what you want in life right now. So you work with anticipatory anxiety. You use your breathing. You use your reassuring thoughts. And that's the same thing you do as you start to actually practice with the mask. You want to start with something relatively simple, and you work with it until you feel reasonably comfortable, and then you add a little more difficulty. So, for example, you might start with simply holding the mask if that creates a little bit of anxiety for you. You do your breathing, you do your reframing, and part of your reframing, part of your reassuring thoughts are that this is just a piece of paper, this is a piece of cloth. I'm holding it just like I would hold anything else, like a can of soup or whatever. I don't have to do anything with it. I just have to sit here with it. I just have to be with it. And you might do that for a minute, but you maybe you carry it around for a while in your house. You get to where you don't think that much about it, or at least the anxiety is less. You just move around the house. As you're doing that, you might want to draw it closer in toward your body. Again, that you're going to see an increase in some anxiety as you do that. That's okay. That's normal. As you do that, you just repeat the cycle, which is you use your breathing to bring down some of that adrenaline. You reframe, and you're just holding it. It's just here. You can do this. So you move it closer and closer, however seems right to you. Some people want to do it this way. Some people might want to bring it in, hold it out here, and then bring it in closer and closer. You might want to wear it around the house like this for a while. You're desensitizing yourself to this mask. And so that's going to take some time to do it. So once when you first put it, you can just hold it like this and again walk around the house. You start with a minute or so until you are able to do it, up to 3 or 4 minutes, 5 minutes, until you're able to actually put it on. And so with each step of the way, it may go back to more anxiety. You use your breathing, you use your reframing. You start with a small amount of time, and then you build up. So I hope this has been helpful in at least providing you with some principles, help you feel that you can do this, or at least you can move towards making wearing the mask more comfortable. This will help you feel better as you're able to overcome this. But ultimately, again, a mask is a means to the end of helping to have a more normalized life for you.